just numbered my days, and I'll go along with everything you say. But I'll ride home laughing.
Oh, hey, Tom. There you are.
Well, Wilbur, I was just thinking about a question.
Oh, do you mind if I join you?
No, please do.
Oh, what were you thinking about?
Well, you see, I have this client, and I suspect that they've experienced some form of trauma. And, well, I don't really know what to do.
So you suspect a client might have some trauma. I'm wondering if you did a comprehensive assessment.
What would make up a comprehensive assessment?
Good question. Well, there's typically 5 things that come with a comprehensive assessment of trauma. The first one is to look at the trauma exposure. What sort of events have happened for them in the past, that kind of thing. Second one is to see if they have any symptoms similar to PTSD. The third one looks at the comorbid conditions, seeing what other types of possible disorders they might have. The fourth one looks at associated features, such as guilt and shame, and those deep things as well. And lastly, the fifth one is response bias, seeing if the client has overgeneralized or exaggerated or minimized any of their things.
Interesting. Now, are there assessment tools that assess those things?
Yeah, there's actually some specific assessment tools that are related to trauma, but also PTSD specifically too.
I'm wondering, Carlos, what are the advantages of using a trauma-specific assessment tool?
That's a good question, Will. Well, any sort of assessment tool that's trauma specific can relate directly to traumatic events and or the resulting symptoms that they've had. So one of the advantages is that assessment tools focus on specific psychological trauma associated with the events. Another one is that it allows the clinician to look at the severity and frequency of the symptoms related with their trauma.
Oh, so it was like when you were talking with Tom and you guys said that the presence of trauma symptoms isn't enough, but we also need to consider the intensity and duration of those symptoms as well.
That's exactly right, yeah. And the third one, the last one, is there's actually specific assessment tools and scales related to specific populations. So if somebody's in the military, if somebody's gone through an abuse, or if they're a child, there's actually specific scales that will measure certain populations.
It sounds like those would be important things to consider if you were trying to be a culturally sensitive practitioner.
Definitely, yeah.
What are some examples of a trauma-specific assessment or scale?
Well, there's many types of assessments, but one of the gold standards, as they call it, is the CAPS.
Oh, I've heard of the CAPS.
Yeah, the Clinician-Administered PTSD Scale. That's considered one of the most accurate and comprehensive measurement tools.
Yeah, can you tell me more about the CAPS?
Yeah. Well, fortunately, we've got a couple copies of the CAPS right here.
That is fortunate. You know, I haven't had an opportunity to look it over yet. Maybe I could take a copy, you could take a copy. We could go through it and reflect on it a little bit.
That sounds great. Why don't we separate, reflect on it a while, and then we'll come back to discuss it.
Good, I had enough of you anyways.
It appears each question has 2 parts asking about a symptom. One on frequency and one on intensity.
The CAPS looks really structured and easy to administer. I bet I could even change this language to make it more appropriate for all kinds of populations.
Hey Will, did you notice that the CAPS can assess current and lifetime PTSD symptoms?
Yeah, that's really useful. And it appears as if it examines more than one traumatic event. Also, I'm not done. Go away.
Okay.
Alabama, Arkansas, I do love my mom and pop, not the way that I do love you.
Well, holy moly, me oh my, you're the apple of my eye. Girl, I never loved one like you.
And they use 30 questions using a 5-point rating scale. It also seems to provide explicit, behaviorally anchored rating scales.
Holy moly, this is exciting. There appears as if there's multiple ways to score it. And the scoring can be adjusted to the criteria of the people administering the assessment. So, for example, the scoring criteria can be adjusted to be more inclusive or less inclusive. Oh, hey.
Hey,
How'd it go?
pretty good. Yeah.
Good.
You know, I noticed a lot of strengths about the CAPS. No wonder it's considered the gold standard.
Mm-hmm. It's very comprehensive.
Agreed.
Yeah. I also thought about some limitations as well.
Do you want to reflect on those a little bit?
Sure. Well, the fact that it is so comprehensive, it's got to take between 45 and 60 minutes to administer.
That's very true, yeah. I was also considering the fact that a lot of it is self-report, right? So there's a chance for some minimization or even exaggeration, or some people might not even be able to describe some of the symptoms they're having.
Yeah, absolutely. And, yeah, it's interesting that you say that. Good point. Another limitation that I noticed while I was looking it over is that it didn't really thoroughly assess the trauma event itself, just the symptoms.
That's a great point, yeah.
Mm-hmm. It's like you would need to administer the CAPS with an additional assessment to look at the trauma events.
Yeah,
Yeah.
I think I know where you're going with this.
Life events checklist.
Yeah.
Booyah!
So, the life events checklist. Tell us more about that.
It's a pretty exciting assessment. It's got 17 questions, self-report. It asks clients to, or people filling it out, to reflect on their exposure to 16 potentially traumatic events.
So it's really narrowed it down.
Well, yeah, it looks at like typical traumatic events and then asks the client whether or not they've been exposed to those events. And it has an other category in the 17th question as well.
Okay.
Yeah. So it gets them to reflect on whether or not they've been exposed to a traumatic event in the past. It can be useful for getting what's called a trauma history, which can be very useful for treatment planning and seeing that connection between their current symptoms and their previous exposure to trauma.
Right. So, Will, earlier when we were talking about assessing trauma, we mentioned those 5 key things that people tend to look for. When assessing trauma history, we use something like the life events checklist, right?
Yeah.
But when we're looking at PTSD symptoms, we look at the CAPS. My question is, what do we use when we want to look at comorbid disorders or associated symptoms like the guilt and shame?
Excellent question. Very exciting question. While in this current context, a thorough examination of assessment tools for comorbid conditions or those associated symptoms might be a little bit outside of the scope of what we're doing here today, I will briefly say that we can use personality inventories to assess those things, such as the Minnesota Multiphasic Personality Inventory. This is a very thorough and comprehensive assessment tool that can give us information about comorbid conditions and about those associated symptoms, as well as maybe even PTSD symptoms.
So it's really it's a comprehensive assessment in a way.
Absolutely. It really ties back to what we were saying earlier about the importance of utilizing multiple assessment tools and having multiple sources of information.
Right.
All right, you're not on fire. I knew it, you're lying. I'm burned. There is no fire.
Come back here.
But something looks wrong. I mean, he's running around like he's on fire.
Oh my God, help me! I don't want to die. Oh, stop, drop, and roll. You're not on fire, Ricky Bobby. I'm on fire.
You're not on fire.
But I'm not even sure he even knows where he's at right now.
This makes us all realize the kind of pressure these drivers are under.
Mr. Bobby, come on down here. Help me, Jesus. Help me, Jewish God. Help me, Allah. Ah! Help me, Tom Cruise.
But how did he get down to his underwear that fast?
Tom Cruise used a witchcraft on me to get the fire off me.
Look, here, help's coming.
Wait a minute.
It's Cal Naughton.
Again! Please don't let the invisible fire burn my friend!
I wish you would step back from that ledge, my friend. You could cut ties with all the lies that you've been living in. And if you do not want to see me again, I would understand. I would understand. The angry boy, a bit too insane, icing over a secret pain. You know you don't belong.
Will, I think it'd be important if we talk about some of the ethical considerations associated with assessing trauma.
Yeah, absolutely. Yeah, ethical and cultural considerations.
Exactly, yeah.
Yeah.
Something I've noticed and we've talked about earlier, Will, is I think you need to find that right assessment tool for the right population. It has to suit the person that you're seeing. So, it would be inappropriate and wouldn't work if you use the assessment tool for veterans on general population, for instance.
It's interesting that you say that too. Originally, the CAPS was created by the U.S. Department of Veterans Affairs. However, it's been normed and studied on the general population as well. So that particular PTSD or trauma-specific scale can be utilized on both those populations appropriately.
Yeah.
But certainly with others, it would definitely be something you would want to consider, whether or not the scale had been normed on that population. Now, when I think about PTSD, being provided with a PTSD diagnosis can have some very serious implications.
No kidding, yeah.
That kind of thing, that kind of label could follow a client throughout their whole lives and potentially cause significant harm. And so it's important prior to giving that diagnosis that we consider multiple sources of data and we utilize multiple assessment tools, like we've been saying all day.
Right, yeah.
Another really important, I think, ethical and moral consideration that we also have to consider is the fact that rushing in to discussing trauma in depth with clients prior to clients having the skills to manage going to that place is potentially dangerous.
Oh yeah, it can be an intense process going through that.
Yeah. The triphasic model for trauma treatment is the most common therapeutic treatment process that we use with individuals that have suffered trauma. Now, it's composed of 3 phases, hence the name triphasic model. The first phase is a safety and stabilization phase, where you and the client build up skills.
Crucial.
Absolutely. So they can have that safety and control over their own inner experience. Because rushing into talking about trauma and what happened to them could cause significant harm. You could potentially re-traumatize the client.
Oh, yeah.
And it isn't until the client has mastered that first stage of safety and stabilization do you move to recreating the trauma narrative in the second phase.
So recreating the trauma narrative. Now, what's that?
It's basically reconstructing the trauma narrative so they make sense of what happened to them.
So it's in a more coherent way of looking at it.
Absolutely.
Huh.
So we always have to consider the impact of performing these assessments on the client prior to performing these assessments.
No kidding. And what's the third
phase?
Yeah.
Reconnection, both with themselves and others.
Ah, okay.
Yeah. And so assessments can also facilitate that process because you become more aware of the client's strengths, for instance.
Right, yeah.
What kind of people and resources are available for them in the community to reconnect with other people.
Oh. Yeah. Thanks for sharing that with me.
Yeah, you're
so
welcome, buddy.
to go back to what you said about labeling, Will, within the military population, there's a lot of stigma around the word disorder. So there's been a lot of talk about actually changing the name to injury as opposed to disorder and having a separate one for veterans.
Like, you mean the name of post-traumatic stress injury?
Exactly. Yeah.
Yeah, that's interesting.
So is there any other ethical considerations that we should think about when assessing?
Absolutely. We have an ethical and professional and possibly even legal responsibility as counselors to consider a client's culture whenever performing assessments or creating a treatment plan or utilizing any intervention. Now, with regards to trauma assessment specifically, we need to make sure that the assessment tools that we're utilizing is congruent or culturally sensitive to the client's specific culture.
Right.